been to the National Guard testing site. And if you have not received your results in 5 or more days, there is a hotline that is available Monday through Friday from 8 to 6 p.m. And so I'm going to say the number is 1-866-419-6988. I'm going to repeat it, 866-419-6988. You can also visit or call Impact 211 for more details about that hotline. The other thing is, as we've seen across Milwaukee County and different municipalities, but now we're also seeing local businesses starting to require masks in their facilities, and so, or in the community. And so I want to remind folks that as we continue to see masks, that we start to check our biases. We know that there will be many individuals who may wear masks, and so we just want to make sure that we make this normal. And so, enforcement of mandatory masking must be equal. And so people of color or whoever they may be must not be singled out and receive different treatment if they're wearing a mask or not wearing a mask. We need to make sure we're not stigmatizing those who are wearing a mask or not wearing a mask, and just be conscious of the biases that are at play. And so as we talk about racial equity, it's important to highlight that July is also the National Black, Indigenous People, and People of Color Mental Health Awareness Month. We're honored to be joined by 2 guests from 16th Street and the Hmong American Friendship Association, also known as HAFA, to talk about the accessibility challenges and the stigmas that exist when it comes down to receiving mental health services, and to share the resources in the community that are available to help. Because COVID-19 has really spotlighted the racial and health disparities that exist in our communities, particularly in communities of color. And these issues do not appear overnight. There's more work to be done to make mental health resources accessible, affordable, and culturally sensitive. And that's one of the reasons why Milwaukee County is dedicating $1.6 million of CARES Act funding to the Behavioral Health Division to continue providing mental health wellness and support services for our most vulnerable communities. And last but not least, we do have a bike drive again that I want to make sure that we highlight that is happening this upcoming weekend. There'll be 2 bike drives, Saturday, July 18th from 9 to 5, both at King Park and Kosciuszko Park. And the bikes will be distributed and donated on a first come, first served basis. So if you want more information, please visit thewecarecrew.com for more details about these events. And with that, I see that the mayor has joined us, so I'm going to hand it off to Mayor Berry. And thank you for your leadership.
Thank you very much, County Executive. And I want to talk just about a couple issues today. And I don't have a lot to add to what the County Executive said, but I want to talk a little bit about our Restart Milwaukee program, because we've really had a beginning of a very successful program here. And this is the program that's geared to small businesses that have 20 or fewer employees, and in addition have $2 million or less in annual income. When we put this out about a month ago, we didn't know what the response would be. And we've had literally hundreds of businesses who have contacted us applying for this money. The maximum grant is $15,000, although all the applicants did not apply for $15,000. But we probably will have, by the time we're done distributing the first run of this, 400 businesses that will benefit from this in every single aldermanic district of the city, which I'm very, very pleased with. 40% of them self-identify as minority-owned businesses or businesses owned by women. So we're seeing a lot of equity there, and we think that that's very, very important. And so the total amount that we'll send out the door will be about $4 million. This is money that comes from the federal CARES money, just so people understand where the money's coming from. And we thought it was very, very important as we receive that money to help small businesses in particular get their legs beneath them. We know what a difficult time this has been for businesses, not just in the city of Milwaukee, but throughout the country. And this will go to help pay for PPE equipment, help to reconfigure layouts of stores. In many instances, will help to replenish the inventory of the business. So we have had restaurants, we've had pastry stores, we've had bakeries, we've had a bike tavern, we've had funeral homes, we've had many, many different businesses that have taken advantage of this program. And that's exactly what we wanted. We're going to continue to look for ways to use this CARES Act money to help businesses, because we do think that's very, very important. I also want to follow up on some of the comments that the county executive made with our mask ordinance, which is now in effect. And as I said at the signing of this, oftentimes when I sign an ordinance, I'm really excited. I'm very happy to do it. This was not one of those occasions. And the reason it was not one of those occasions was because by signing this ordinance, it's a recognition, which is, I think, is a recognition we have to make, that we have not done everything that's necessary to fight COVID-19. And I would love to say that everything is going great here, but I think you'll see from the number of deaths, and Dr. Weston can talk about the number of deaths we've had. We've had a increase in deaths, and I had a young woman that I literally grew up with who just passed away in the last 48 hours from COVID-19. So I think more and more people are seeing this hit individuals that they know personally. But what we are seeing is we're seeing good compliance out the gate. If people are looking for masks, they can certainly get them from one of our healthcare centers on the northwest side, the Keenan Health Center, on the south side at our Southside Health Center. They can also get them at the Zeidler Building, and we'll have more locations. And we are going to make a very concerted effort to get these out into the community. And the county executive was talking about the racial equity components of this, and that's something we feel very strongly about at the city as well. But we're pleased that we're seeing a good response so far. And again, I understand there's some people who don't like them. I know some people think this is all political. It's not. It's about saving lives. And what we have seen in the 4 months that this has really been upon us is we've seen the average age of people who contract the disease going from the largest group between 50 and 60 to now the largest group being those individuals between 20 and 30, the invincibles, the young people who think they're Superman or Superwoman. And they may be, but they may be asymptomatic and they may be carrying this disease and infecting other people. So it remains a very, very serious concern. And we are taking it very, very seriously. So with that, I'll turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers. Turn my video on. Good afternoon. First to our numbers, we have 15,179 confirmed cases of COVID-19 in our community and 365 individuals who've died. As we see much of the rest of the country moving in the wrong direction with their case numbers and their percent positive of tests, we've seen similar moves in many counties throughout Wisconsin. And now we're beginning to see some trends and numbers in Milwaukee County that suggest we may be going down the same unfortunate path of increased true burden of disease. We're seeing daily case counts similar to what we saw in our previous peak in mid-May. Along with those case counts, we are also seeing a gradual increase in our percent positivity. While the positive trend over the last 14 days did not reach significance to change our indicator color today, we are seeing a significant positive trend when we look over the last month that suggests a true increase. Finally, we see today the highest number of COVID hospitalizations in our county that we've seen in over a month. This is a single data point, but one of concern that we'll continue to monitor closely. Each of these items, combined with what we're seeing in much of the state and much of the country, suggests that we may be in for worsening numbers in the coming weeks. As we've seen in other states and counties, a worsening burden of disease often leads to a backstepping in phasing and opening up and increased damage to the economy and the community. We do have an opportunity as a community and as individuals to slow transmission and prevent worsening burden of disease. As individuals, we can take time to consider the safety of the events we engage in every time we leave our home. Unfortunately, this is the world we are currently living in and will be in for some time to come. Questions like who will you interact with, where will you be, how long will you be there? If it's possible to minimize the number of people, do activities in the open outdoor space, and minimize your time in close contact with others, that will minimize your likelihood of getting COVID-19 or unknowingly transmitting the disease. And really, we as a country, a county, and as a community must move past the debates on mask usage. Multiple studies have demonstrated the utility of masks in slowing the transmission of disease. It's a small step to take, a minor personal sacrifice, really in a time when our healthcare workers, our frontline workers, our essential workers are making far greater sacrifices and taking increased risks to keep our community moving forward. Just wear a mask. We as a community and as individuals can be proactive in slowing transmission and must act now before we're forced to act by untenable case counts and overwhelmed hospitals. Thank you and stay safe.
Thank you, Dr. Weston. And now we'll hear from Director Roush.
Good afternoon, everyone. It's my pleasure to join as one of the suburban health representatives from the Greenfield Health Department. I have the pleasure today to talk with you about the data, and just echoing the same sentiments and conversation that Dr. Weston just had. The data is definitely trending in the wrong direction. So let me go ahead and share my screen here, and you will see the current week's data. So as Dr. Weston mentioned, we have over 190,000 tests performed, just under 15,000 positive tests in Milwaukee County. We trend new cases a lot, and we've talked about this time and time again. We had a notable peak in mid-May that was very noticeable in the city of Milwaukee, and we're certainly not quite there yet, but approaching that peak right now within the last couple weeks. I want to know, most alarmingly, that we have reached the highest number of cases in the suburban communities that we have throughout the 4 months of the pandemic thus far. And that's something that's certainly trending, continuing to trend in the wrong direction. So cases are up, as we've talked in the past. Deaths continue to be down, but as Mayor Barrett said, that doesn't mean deaths aren't occurring. So we need to be very cognizant of the fact that we don't just dismiss COVID because it's not killing anyone. These numbers are still people, and the deaths are significant. We've talked a lot about our growth rate over time, and we've looked at the reproductive number, or the transmission rate. And this graph essentially is showing that we started out very high during the early parts of the pandemic. We went down dramatically due to safer at home and a lot of those measures that we put in place in March and April. We had some increases back in May, and notably, I will remark that in July here again, we're seeing increased transmission within Milwaukee County. Currently, our transmission rate is 1.38, which means for every one individual who has COVID, they will, on average, infect 1.4 other individuals. So that is a transmission rate that is increasing the outbreak in our communities. This week, for the first time, we further broke down that transmission rate by both the city and the suburban communities. And you see the city of Milwaukee on the top, the suburban communities on the bottom. And as I said, the growth rate of COVID in the suburban communities is exceptionally high, and our transmission rate in the suburban communities is higher than that in the city of Milwaukee. And you will note here that this peak is right around the 3rd of July. And so we do anticipate to see a little bit more growth in that peak in the coming weeks, because we know there's been a lot of transmission happening in and around our communities. We've talked a lot about age growth, our age rates, and growth of COVID in that age population. And we've seen another significant increase amongst those who are 18 to 39. And they continue to be not only now the leading number of cases, but they're driving the rates of COVID cases. So the rate of disease amongst those who identify as 18 to 39 years old has surpassed that of our oldest age groups. And that's certainly something to make note of. Lastly, I'll look at, or second to last, we'll look at testing coverage. Again, we continue to see tests increasing, and that's good. Almost 22,000 tests in the last week. And the positivity rates continue to climb a little bit. You see here on figure 13, but in the 14-day trend, we see an upward statistically significant increase in percent positivity. And that's something that we're watching as we look at that as a metric to open up again. And unfortunately, that is continuing to trend in the wrong direction. And lastly, I'll leave you with the case map of what's happening in the current week. This is the COVID incidence rate of new cases between July 8th and July 14th. And you'll see pretty widespread activity throughout the county, especially in some of the southern suburbs and even in some of the northern suburbs. So just again, showing a lot of COVID activity in and around our community. And that's something we need to be very cognizant of. I echo all the sentiments of other speakers. Wearing cloth face coverings is important. Maintaining social distance Staying home except for essential trips is all very important as we try to prevent COVID from continuing to run rampant in our communities. So with that, I will end because I know we have some other speakers. I'll turn it back to you, Catherine.
Catherine, you're on mute.
Wow, thank you. All right, it's only due time. So Darren, as you unshare your screen, we will hear from Tia Ostrike, who's our bilingual psychotherapist with 16th Street. Tia, thank you for joining us.
Hi, thank you. Yeah, my name is Tia Ostrike, and I am a therapist at 16th Street Community Health Centers. I work in our substance use and behavioral health departments. So to speak a little bit about stigma of seeking mental health care today, I thought about some things that I've heard from clients. I have heard clients say, if people knew that I was talking to a therapist, they would think that I'm crazy, or I must be weak because I am seeing a therapist or taking medication to help manage my mental health needs. And I think it is so important to first denounce those things and to really normalize seeking mental health care in the same way that we seek medical health care if we need help with a medical health need. I think it's important when working with clients to explain my role and to say that, it's my job to provide a non-judgmental space for my clients to discuss and reflect on their experiences and thoughts and feelings. And I think most people could agree that at some points or another in their life, that it could be helpful to have that kind of space that is non-judgmental and a place to reflect and to do that processing of whatever's happening for you. I think additionally, it's important to discuss barriers, and in my experience, in particular to the Latinx community, I think it's important to acknowledge a barrier of language. In my personal practice, it has been extremely powerful to be able to speak a second language and speak with clients in a language that they feel most comfortable and most confident. It is already vulnerable to seek mental health care, and so to be able to do that in a language that you feel most confident is really, really important. I also want to bring up the potential barrier of insurance, as well as documentation or immigration status. That could likely be a barrier for someone in the Latinx community for seeking mental health care. And it's important to know that at a clinic like 16th Street Clinic, we serve individuals who are uninsured, underinsured, as well as have insurance. And so that does not prevent you from receiving mental health care. And similarly with documentation or immigration status, that also, we work with several individuals with varying immigration or documentation status. So that does not prevent you from receiving mental health care. I think it's lastly important to note that there is a certain level of privacy as well that exists in receiving mental health care. And so to feel that that is a protection as well, and know that if you are seeking care. Thank you.
Thank you so much for joining us and sharing those resources. We'll now hear from Long Shang, Project Coordinator with the Hmong American Friendship Association.
Well, good afternoon, everyone. Again, my name is Long Shang, the project coordinator at the Hmong American Friendship Association in Milwaukee here. The organization has been incorporated since 1983, helping the Southeast Asian community in the greater Milwaukee area, for years like that. And then myself, working here also, and beside being an interpreter, translator for over 20 years too, within the Hmong community, and I have seen a number of instances in regard to some other issues beside the mental health issues here. And I think in order to talk about the mental health, I'd just like to take a little moment here to give you a little background about the Hmong first, to understand how the mental health issue do exist in the Hmong community, just like anybody else too out there. But back in the Vietnam War era, the Hmong were recruited by the American CIA to fight the expansion of communism into the Southeast Asian peninsula, and then to rescue down American pilot down into on the jungle in the mountainous area in the northern Laos. And so back then, during the whole Vietnam War, 15 years, about around 35,000 Hmong died. But after the fall of Laos in 1975, into communism, that the Hmong faced persecution for siding with the American and also for fighting in the secret war. The Hmong had to flee out of Laos. And so during the whole fleeing process here, the Hmong faced a lot of obstacle, and an estimate of 50,000 Hmong died during the whole phases of 1975 to about 2000. So the Hmong start to flee from Laos from 1975 all the way to about 2008 in many different phases as refugees into America. So really do appreciate it, the opportunity to be rescued by the American government here to come to this country. We do appreciate that. And as being refugee, and also with a lot of language barrier, we face a lot of issues, then causing a mental health issue on that. And talking a little bit about mental health, it does exist, but just that it's something new to the Hmong. For example, the mental health, we deal with the brain, but then in the Hmong, we don't have vocabulary for mental health at all. And we said Marsha, which is about the liver now rather than the brain. And so Nuasha, Lusha, Susha, it's all about the liver, but somehow that's related to the brain, definitely. But it's the lack of vocabulary, lack of the language, technical terminologies. It's very difficult. And as an interpreter too, being out there in the field, helping clients, helping patients out there with professionals, mental health professionals out there, it's very challenging. And I think the stigma of the challenge for the Hmong is, definitely is to understand that it's really something that we do need to seek help from mental health professionals in order to help in this situation like that. And so last year, we had the Hmong American Friendship had a project, and thanks to the Department of Health Services from the state of Wisconsin, and in partnership with WOCMA, which is a Wisconsin United Coalition of Mutual Assistance Association in Wisconsin. It's an umbrella organization with 15 other Hmong organizations throughout the state here. We work together. We got this project together, and also in partnership with the Milwaukee Nyazhong TV, and we did spread out the word that yes, mental health does exist within the Hmong community, and it's important to really get help. It will not get well by itself. We have to get professional help and all of that. So the Hmong face a lot of challenge, and then along with COVID-19 here, that's another issue on top of just the challenges that we do have already. And but thanks to all the officials, the elected officials who really put importance on this particular issue to really make sure that our citizens, the Hmong community also, do live well and safe. So we do appreciate that.